Hi, everyone. Welcome to PeopleMetrics Live. My name is Alexandra Quintero, and I'm the Senior Director here at PeopleMetrics. And today we'll be discussing Pharma's high-impact customer, rare disease patients.
All right. So, so this is a really interesting topic. So I've been talking a lot and writing a lot lately about something, I'm calling high-impact customers. And high-impact customers are the customers, and every industry has them, that you really can't afford to lose. They tend to have a disproportionate weight on the business for a variety of reasons. It could be a financial weight, it could be an influence weight, it could be, a weight around just simply there's so few of them that if one of them leaves, it just impacts the business disproportionately. And every industry has these, and pharma is no different. Pharma has mass market medications, and pharma has rare disease or orphan or specialty drugs or whatever you want to call it, but it's essentially drugs that are created for a very small number of patients. And these patients have, a disease that isn't common, but to them and their families, it's extremely important and critical that they get treatment for the disease. In many cases, it extends their lives and their quality of life, and that has immeasurable value to the family, the patient, as well as the pharmaceutical company that's spending quite a bit of money, in R&D and all the different phases of getting a drug approved to go out to these, in some cases, thousands of patients, right? So these thousands of patients tend to be quite different than, say, a mass market medication for high cholesterol or blood pressure or something that has a huge market. And just the experience that those patients have when on their treatment journey is going to be very different than the treatment and the journey of a mass market medication. So, Audrey, and you've heard me say this before, that pharma rare disease, in terms of delivering experience, has a lot more in common with, say, luxury hotels than anybody could ever imagine. Right? You've heard me say that, right?
Absolutely, yes.
You're probably tired of me saying that, but that's okay. But what do you think about that statement, and how does that resonate with you? And do you think I'm just totally crazy, or do you think that makes somewhat sense?
Well, maybe the first time I heard it, I thought you were a little crazy, but no, now I think it really resonates, and it's such a good analogy to help people understand how pharma companies should think of the patients that have rare diseases and are on these medications. So I think it's a really good analogy that I'm excited to explore more.
Yeah, and the reason why I say it is, very, very high-end luxury hotels, they don't have a lot of guests. It's usually a handful of them, but the experience that they have has to be carefully curated, intentionally created, measured a lot, recover when something goes wrong, recovered quickly and personally. And, because they know, there's a reason why that is. They know that it's not about that one time, it's about the next time, and it's about referrals, and it's about, creating that experience that can happen over and over again. And the lifetime value of a regular guest of a luxury hotel is very high. The same with a rare disease patient. The lifetime value is high. It tends to be a more expensive product to have treatment on, because there just aren't that many of them. So without the high price, it wouldn't make any sense to develop the drug, right? So there has to be a commensurate higher price. And it tends to be a very serious disease in many cases. So when these patients are onboarding to the new product, the experience they have onboarding and then over time is extremely important, critical, and really needs to be managed intentionally and curated, like someone would curate you walking into, a Four Seasons in, I don't know, wherever, Turks and Caicos or whatever. They wouldn't take that experience to chance, right? They wouldn't just say, well, whatever happens, happens when Audrey gets there. I hope she gets to her room, right? That's not the way it is. It's the same thing with rare disease patients. It's not about, oh, well, you know what, when they onboard, and if they do or they don't, we're not concerned. That is not the way, that isn't the perspective, right? It is about helping them every step of the way on their treatment journey, from initially onboarding through adherence to a much better life over time. All of those pieces of the experience need to be curated and managed. So that's why that's kind of the analogy.
Yeah, what stood out to me, I think, is that the stakes are higher for these people. The people who go to luxury hotels are much more likely to return. They're much more likely to talk about it with other people who are likely to go to luxury hotels. So for the hotel company, they want to make sure that it's a carefully curated experience that will set them apart from other hotels so that these customers will return. And the way that that connects to pharma for me is that they need to carefully curate the experience of these patients who are their customers. And we kind of use patient and customer interchangeably when we're talking about pharma here, because without these patients, you're right, pharma wouldn't be doing the research and development on these very expensive medications that save people's lives. So they need to make sure that patients are able to easily get access to onboard, to have nurses to help them at the infusion site, to get the information they need, to have somebody to call when they have a question. So again, same thing, that it needs to be carefully curated. Someone needs to look from beginning to end of that patient experience or patient journey, and make sure that everything is laid out and going the best that it can, so that the patients have everything they need and are able to stay on these medications.
I have a couple of statistics for you to react to. And these are high impact customer statistics data. Right. So business travelers on airlines, they make up 12% of the passengers and 75% of the profit. Okay. Think about that for a second. High impact customer, right? And it's in every industry. We were talking about hotels, but it's in airlines, it's everywhere. And specialty drugs or rare disease drugs now are accounting for over half the spend, the drug spend in the world, is from one study, recent study I was reading. It doesn't mean that the number of patients are far, far fewer than the number of patients that are on therapies in the world. But in terms of the spend on those therapies, specialty pharma is now over half the overall spend, which would indicate that these patients that are part of that spend need to have experiences that are different than the rest of the market. And that's what we're talking about here. And you've worked with a lot of rare disease, help pharma with rare disease patients. How are they doing this? Like how can they create, what can they do to make it special and different? Like what are the things that they have at their disposal?
Those statistics are kind of mind-boggling to think about. All the travelers, but only 12% of them are making up such a huge proportion of the profit, or that specialty drugs are representing 50% of the market. That's mind-boggling. But yeah, I have worked with clients who have rare disease medications and these smaller high impact patient populations. So they're doing things like setting up patient support services teams where they have a dedicated case manager or patient support services representative for each patient, who guides them through the whole experience of onboarding onto their medication, talks to them at key touch points in their journey to using the medication, helps them with access to samples, to insurance, works with their healthcare providers to make sure they can get what they need, coordinates travel if they need to go to special sites for infusions or other in-person things. It's sort of like a full circle look at what the patient needs, and then the patient support services team figures out how to provide that for them.
That's really, an incredible description of the journey that the patient has and how pharma can support in that journey, either through patient support teams that are internal to pharma or partnering with a hub that delivers similar services to the patient. the patient doesn't really care. They just want to make sure that their journey is a great experience and as frictionless as an experience, right? We talk a lot in customer experience about it being frictionless and easy, right? And that's something that the best patient support teams that I've seen make it so for the patient, right? And the caregiver and the HCP, which are part of the ecosystem, the stakeholders that, I have this new book called Pharma Customer Experience, which we haven't talked about, but we probably should. That's out on Amazon. And one of the questions I ask in that chapter is, who is Pharma's customer? Is it the customer? Is it the patient? Is it the HCP? Is it the caregiver? And really the answer is yes, right? Like I argue that it's the patient is the primary customer, but the HCP and caregiver, especially with rare disease, have to be considered as part of the experience, right? And pharma needs and does in many cases, create experiences for each of them to make sure that especially the onboarding touch point. And maybe I wondered if you could just talk just a little bit about that. The onboarding touch point is so critical for rare disease. It's like for the hotel example, it's, if you don't have a good check-in, your stay is often not very good. Like that's the data that we've seen over the years. Like if you have a bumpy check-in, meaning they didn't know who you were, you struggle with luggage, there's a long line, you get to the front of the line and they don't have your room ready, or it's not the right room, or they don't direct you to the elevators, or once you get to the room, it's not cleaned. Like that bumpy start makes it very hard for your journey in that hotel to be a positive one and for you to come back. And it's the same really and it's even more important for rare disease patients. And believe me, I am not making light of the seriousness of rare, and I am not going to, it's not a comparable thing around the consequences, right? We know the consequences of onboarding is a lot higher than a good experience at a hotel. It's just what we're trying to do is set up the parallels between the two of them and the care that a hotel will put into that whole experience, a good one. And that's exactly what pharma is doing with rare disease, the good patient support teams. And how does the onboarding touch point, Audrey, really, why does that matter so much?
Onboarding is so important because it's really the patient's first experience with this medication. And you have to remember with rare disease, these patients are often pretty ill. They really aren't feeling well. They have a host of medical issues that need to be addressed. And that's why they're going to be onboarding onto these medications. So it needs to be, as you said, as easy, as frictionless as possible, both for the patient and whoever's helping them coordinate their care, their caregiver and the HCP who has to be able to write the prescription to understand how they're going to get access to the medication, to deal with insurance pre-approvals and coverages. So onboarding is so important because it's the beginning of that experience. And studies have shown that patients who have successful and easy onboarding experiences have better adherence long-term to staying on their therapies. So it's important to the pharmaceutical company too, and it's important to the patient's health that they onboard successfully and then adhere to the medication. So onboarding has to do with getting access to the medication, getting their delivery successfully, or going to the correct center where they're going to receive the medication, making sure that they're able to tolerate the side effects, making sure that their insurance is covered. There's a lot of different pieces that are involved in that onboarding section of their treatment.
Right. And we know that financial access is key, and that's where a lot of the effort goes, but it's more than that, right? You mentioned, knowing, how to get the medication, if it's a logistical issue, knowing how to administer the medication, if they're doing it by themselves or with a caregiver or even at a location. And then even finding support groups. And a lot of the support is through case managers that rare disease patient support services teams are delivering. And those, they are part of the team, right? Like that's what we see from our data, from the patients who are commenting, is they consider the case manager a key part of their team to help with this journey.
Yeah, I think the case manager plays a lot of roles besides helping they sort of understand what the patient is going through because they have a good handle on the disease state and the medication. And they're a great resource for connecting the patient with other people who are going through the same thing via support groups or materials that are out there. So we do see that often in the data that patients truly appreciate the connection with their case manager and the knowledge that they're able to share with them.
And look, there's something else that we need to talk about is, there's different ways to deliver experiences for any patient when they're onboarding or even after they're kind of taking a therapy over time. There are high touch approaches like what we're talking about with patient support services teams, with case managers and call centers, and and typically this is provided to the HCP, and the HCP informs the patient that these services are available and says this is how you find them. And then there are the digital ones which is all the rage. We know there's a lot of dollars being spent on them. The digital lower touch support services through websites, portals, apps. They definitely have a place, but from the data that we see, it seems like in many cases, the pharma companies like those apps more than the patients do at times. And there's probably a balance there, right? That you need to meet.
You're right. Yeah. And I think because we've been talking about rare disease, I think everyone sort of understands that this high touch model makes sense. But I think it is important to look at what's happening otherwise. Patients don't like chatting with a bot and not being able to find the information that they need, or getting lost in a phone tree when they have a specific question that they really need a person to talk to get them an answer.
Especially high impact customers. And this is the parallel across all industries, because all industries have this issue. It's like, you can't service everyone with a high touch model. It doesn't make sense financially, right? That's the key. And you have to pick and choose who you provide these kind of higher touch, more expensive support services to. And really it's the high impact customer. And I'm looping back to the theme of the talk today. When we have some characteristics of high impact customers that go across all industries, but especially apply, we think, to the rare disease patient that we're going to go through. And hopefully this is a framework that'll help you think about kind of why we think these patients fit into kind of our definition of high impact, and maybe other applications that you can think of also for pharma. So first of all, Audrey, one of the core tenets of a high impact customer is this notion that they're demanding. And it's not like they're difficult. We're not saying that they're difficult, but their expectations are super high. So so rare disease patients, there's not a lot of them. You mentioned it. They're often sick. They're going through a difficult time. And, their expectations for the experience, I don't even know if they're thinking about it, but inside they know they need help throughout this part of their journey. And it's got to be more than a bot.
Yes, absolutely. And I think their expectations are that there's going to be someone to guide them through this process. And that's what the pharmaceutical companies really need to provide. The HCPs aren't equipped to help them through the entire journey. They're there to get them prescribed the medication that they need. Correct. But it's really getting past that into the next steps of physically onboarding, making sure they have all the information, and that's where their expectations lie. It's that they will have access to and easily get the things that they need in order to get their medication. So I agree, not that they're difficult, but they're demanding, and that they have expectations of how things should go once they're prescribed the medication.
Right. And this is true for high impact customers across every industry. They all have high expectations. They're all at a point where, their business is available to you, but you have to know that there's going to be some effort in order to fulfill those expectations.
Yeah.
All right, Alexandra, we have our second characteristic, right? Distinguished. So, and we've already mentioned this, Audrey, right? In terms of the experience itself, Like I have this saying that in every industry, and we can apply it to rare disease patients will have experiences with your support team, whether or not you curate them or not. It's a lot better if you're creating and curating the experience and thinking about what experience they're going to have beforehand, because they're going to have them. And if it's a random experience, and if it's inconsistent, and if it's difficult, it's still an experience they're going to have. But the goal is for it to be distinguished, special, and created by either Pharma, which we wrote here, or a partner hub that you engage with to deliver kind of that experience to the rare disease patient.
That's such a good point, that the experience is going to occur regardless of if you carefully create it or not. So if you don't, it's going to fall to chance. Do they get someone on the phone that they know that knows what they're talking about? Did they find the right thing on your website without anyone showing it to them? Did they, all those things that they're looking for, they're going to look for them regardless of if you put the thought into creating how they could get there or not. If you do, the experience will be so much better for the patients that you're trying to onboard.
Does the HCP have a very clear piece of information that the patient gets? Is the number easy to find on that piece of paper or website? When they call the number, are they getting a human, or are they having to fight through a telephone tree? When they get that human, is that person knowledgeable about their disease state and the different offerings for the patient support teams? When they have a question, can that person answer it? Or if they can't, do they direct them to a place where it can be answered? Right? There's all these parts of the journey that that patient support teams have control over and can map and curate and create, and they do. The best ones do. But this has to be something, that's why I keep bringing up the parallel to the hotels. It's like most of these great hotels, it seems like they're not doing much because the experience is so great, but it's because they've crafted it so carefully that it feels so great. And it's every industry has that opportunity. And with high impact customers, you just almost have to do this, because you can't have them having poor experiences, because especially here, the stakes are too high. They're simply too high. This is a life or death stake. This isn't like, oh, am I going to have a great experience at a hotel or not? I can go to another one. This is much more important.
Absolutely. Yeah. I think the thing is that these distinguished or curated experiences don't happen or aren't by happenstance, that they have to be thought about and planned.
Right. And you might say, well, how do we do this? There's a chapter in my book, chapter number 3, all around customer journey mapping and how Pharma can map a journey of a customer. And that can be a patient, that can be an HCP, that could be both. And you think about each time that you interact with that customer, how would you like that customer to feel? And how easy is that interaction? And what would you like it to be? What's the ideal state? And that's how you start to kind of figure out, what are you going to offer at each point in the journey? It's not easy, but it's totally worth it.
Mm-hmm.
All right, let's get to the next one. Dedicated, this follows, right? So dedicated means that in all likelihood, you're not going to be able to automate the experience fully to a technical solution. That high impact customers, and especially rare disease patients, they require a team of support. And we write here, from their HCP to case managers, they're part of a full team, and the team has to be available. That's why it's important for them to be able to call and get a human being, right? Audrey, we see this in the data all the time. Case managers are really valued by rare disease patients, and they often can make the difference between, a good and a not so great experience around onboarding.
Absolutely. And we're talking about things like a dedicated phone number or email address, not something where they have to call and get through a phone tree and then get to the call center and then explain who they are and what medication they're on and how long they've been on it. They shouldn't have to answer all those questions every time. They should have someone dedicated that they are reaching out to specifically, their individual case manager who's available to help them.
Right. And dedicated, the beauty of this is the fact that patient support services are becoming so, omnipresent across almost all drugs, especially rare disease. I was just reading something yesterday that Pharma is now spending $5 billion a year on patient support services across the industry, which is, everybody realizes how important this is. And that's across everything, digital, high touch, whatever. But a lot of this is being dedicated to this high touch model that does need a team. And the reason why it works, and this is in my book, is that, like you said, patients who have a great experience with patient support services, they're onboarding at a much higher rate than those who aren't. And that's why this is worth it. It's worth it financially because the investment in support services does yield a return. And it's the right thing to do because you've got patients who are obviously going through probably the most difficult time in their lives, and you're providing them an on-ramp to a better life. And that on-ramp is all the services you're providing to help them onboard and then adhere over time.
Right. And I think it's because the model works. You said that
Totally.
there's, these pharmaceutical companies aren't spending $5 billion because they feel like it. It's because the model works and they're getting the return on investment and it's helping their patients.
Right. Yes. And one more, right? Our last characteristic is, drum roll, please, delivered. So look, all high impact customers and rare disease patients are no different. It's fine to, know they're demanding and then create the experience and have the team, but you have to deliver it. Like when they call, you need to have a knowledgeable person there. Rapid and personalized are two kind of characteristics of this special treatment that we see across a lot of industries. And this is no different, especially when it's around a life-threatening disease. Getting questions answered in a short period of time that's for them and their disease state. So when they're talking to a case manager, right, Audrey, you see a lot of this data, they have to feel that case manager understands their disease state. It's not some common knowledge that they're looking for. They're looking for, whatever it is, that case manager understands it deeply.
Yes, absolutely. That's a huge part of it. These patients don't want to feel like they have to explain the adverse event they experienced multiple times, or the issue that they're having getting access, or the issue with their insurance company covering or pre-approving their medication. They want someone who is understanding of what they're going through and is knowledgeable about helping them. And that's really the final piece. It has to be delivered.
It has to be. And it's not like they're not looking for general advice on insurance. They're looking for advice for my disease state, my insurance that I have. What else do I need in order to get this paid for? What are my options? What are the programs that pharma companies are offering, which they do provide financial assistance in certain cases. And it needs to be spot on, the delivery. And that's part of the curation process too. It's like, how do you want it to be delivered?
Absolutely. And that personalized piece is so important because no two patient is the same.
Yes.
And that's what really pulls this all together, so that patients feel like they have what they need and are able to onboard, and then will maintain their treatment because they have these four things together.
Boy, that half hour flew by, huh, Alexandra? I can't believe we're already. Is there any questions that we have coming in from the audience that we want to tackle, or are we out of time today?
Well, it's technically at the 2:30 mark, but we could stick around. How do we know we are delivering the support that rare disease patients expect?
Yes, well, that is the question, isn't it? So I'll take this one, Audrey. So every patient support team should be measuring the quality of the service they're delivering to patients through the patient's perspective. So, reaching out to the patient regularly within their onboarding experience, through surveys and other mechanisms to understand what their experience is, that's the way to do it. We've been working with patient support teams since 2015 at this point. So we've accumulated quite a bit of, benchmark data on what is a good performance and what isn't. But I think the first step is just listening to the patient about what the experience is. Would you add anything to that, Audrey?
I was going to say the same thing. It really is, you have to ask them. You have to ask the patient about the experience and make sure that it's meeting the expectations you had when you curated it, and that it's meeting the patient's needs.
Yeah, in my book, I have this 3-step process, and 1 is curation or intentionally creating. 2 is measuring whether the experience is a good one or not. And the 3rd one, which I think we'll just throw in here to end this PeopleMetrics Live, is, taking action on the feedback and making change. So when you hear from patients that a certain part of the process is hard or creates a lot of friction, really taking a close look at that and making a change, and then seeing whether that change worked by listening some more, measuring some more. And that's how every great company who delivers an exceptional experience does it. And nobody does it right the first time. It's a process where you listen, you change, and you listen some more until you get an experience that is, kind of where you want it to be.
Oh, this has been a great session. Thank you both for joining us and going over this. And thank you all for attending. We look forward to seeing you on our next session of PeopleMetrics Live. Goodbye, all.